County Health Team, Dr. Mo Wilson, the Medical Director of the CAVN Hospital. All our ORCs of health facilities here present. Our DHOs of all our 4 health districts here present. The Director of the Community Health Department, James T. Vanny, and all members of the County Health Team. Our journalists and government officials, representatives from the Superintendent Office, our distinguished ladies and gentlemen. Today is an opportunity for us as members of the Margibi County Health Team to, in the past 3 years under the proper agenda of President Weah, to have the GOL fundings that will be elaborated more by the CHO to carry on some major development on our administration as a county health administrator. This is an achievement, and we must be happy because the Margibi County Health Team is moving from somewhere to another place. On behalf of the County Health Team, led by Dr. Gossi Fana, we want to officially welcome all of you, and we hope that the little time you spend will be rewarding to you. You are welcome. Thank you.
Thank you, Mira, for that exciting welcome remark. Moving forward, we'll quickly call on this podium, though the podium is not here, Dr. Augustine N. Fania, the CHO of the Margibi County Health Team, to make a special remark and also use that occasion to turn over the logistics and full actions to our ORCs and the district health team. Thank you, Doc.
Okay. A representative from the Office of the Superintendent, our senior managers at the county health system, our county supervisors, the medical director of CH Rennie Hospital, our 4 district health team members, along with all our OICs from our public facility here present, members of the 4th Estate, our health partners, distinguished ladies and gentlemen. Well, today is a very happy day in our life as the Margibi County Health Team because this day will set the pace for improved health services at our public facilities, thus reaching the unreached in our underserved populations that are attached to our different facilities. We took over the Margibi County Health Team in August of last year, and in September, up to the first week of October, we did a tour of all the facilities in Margibi. Margibi as a county has an estimated population of over 275,000 people. And health-wise, we have 4 health districts. And facility-wise, we have 62 plus health facilities, both primary and secondary facilities in the county. And as we took on the tour, we realized that our public facilities in the county could not reach our targets with respect to the indicators that we have as a health system that will make us to know as a health system whether we're working or we are not. Because even though routine services were going at those facilities, but some of the communities are far away, so reaching children to be vaccinated, one-on-one, to have be fully vaccinated, and then pregnant women to be reached to complete their ANC visits were a little difficult. But we realized from the tour the Margibi County Health System has many challenges, ranging from infrastructural challenges to logistical challenges. So based upon that, predicated upon that, we met as a senior management team. We said we have to do something about it. And one of the things to do is to provide mobility for our facilities so that the vaccinator and the midwife can do regular outreaches to underserved communities so that people receive the needed services. So from support from the government of Liberia to the Ministry of Health to the Margibi County Health Team, we've been procuring these motorbikes little by little. All right. And these motorbikes procurement came from the support that came from the Ministry of Health allocation, Ministry of Finance, the government of Liberia, to the Margibi County Health Team. We decided to procure these motorbikes so that the facilities, the public facilities, can have opportunity to use the motorbike to reach the underserved communities in Margibi County. When you look at Margibi, you think that it's an urban place. You quickly tend to forget that there are also many communities of Margibi that are rural areas. And they are also far from the facilities that we have. And as part of the health sector, desire to make health system better is to reach those people that are far away, that are not able to, are beyond 5 kilometers, are not able to reach the public facilities or the facilities we have for treatment. So that is the reason why we're able to procure these motorbikes. And not only for the public facilities, but we also procure one motorbike for each of the district health teams. Because the district health teams on our structure are the one charged with the responsibility to supervise the facilities that are in the district. And they cannot be going from one facility to another. To enhance their work, in terms of logistics, we also procure motorbikes for the district health team. So I will make it plain to tell you, in Mama Kaba district, we have public facilities there that will receive motorbikes and rice. We added the rice to it because we just came from the festive season. All right, and let me be quick to inform you that the president in late December during the festive season gave the county health system 100 bags of rice for $100,000 Liberian dollars. And we want to say a big thank you to the president. It was distributed between the hospital and the county supervisors. So the facilities and the district did not receive. And we thought it wise that since it's a festive season, it's important that you are part of the system also. They themselves should receive some of the support. So as a county health system, we decided that we'll also procure rice so that at least the staffers in the facilities can also benefit from the Christmas season. And that we say thank you also to the government of Liberia for providing all of these things that you see here. So ladies and gentlemen, we want to say thank you for coming. And we want to sound this, that these motorbikes are not for people to take ownership of it. These motorbikes are not for ORCs to say, if I'm not using it, nobody will use it. The motorbikes is strictly to reach the underserved communities, catchment communities that are attached to those facilities. So we want to encourage OICs, the district health teams, to make use of the motorbike, and we want to see an increment in our indicators by outreaches to the underserved communities. We do not want to see you flying or flying the street of Kakata with the motorbikes, and then the vaccinators and the midwife in the facility are still walking. They are still walking, and then the ORC take the motorbike and carry it to Monrovia to a house or to a house. We want to sound that as a caveat. That if we see that and we receive complaint, we want to sound it to the facility staff. That the motorbike is not an ORC property. It is not a DHO property. It is for the district and it is for the facility. It should be focused mainly on midwives and vaccinators reaching communities that are underserved. And I want to stress this because from my experience of working in other counties, other places, where we see sometimes OICs or district health officers take motorbike and carry, and then the people are still struggling. Let's make Margibi different. So each facility here, public facility here in Margibi, we have procured a total of 23 motorbikes and a total of 152 25 kg bags of rice. Each facility will receive motorbikes. Clinics will receive 5 bags of the 25 kg. And we expect the staff for those clinics to benefit, at least to have something. The Christmas and New Year and Papa will stay in New Year. So they can be able to get something and say, oh, we want to inform you that the different clinics and things, the facility in Margibi, you are part of a system. And this is our way of motivating our staff so that all of us gear towards making health services reaching the people of Margibi County. So each clinic will receive 1 motorbike and 5 bags of 25 kg rice. And each health center will receive 1 motorbike and 10 bags of 25 kg rice. We expect that the supply of rice to those facilities will be distributed to the staffers so that everybody benefit. All right? It is our way of saying, even though Merry Christmas and a happy, prosperous New Year to all our staff in the facility as we all gear towards making Margibi County Health System second to none in the Republic of Liberia. As I take my seat, I want to say thank you to all of you, the senior management team, to come out for us to reach to this decision and carry on this procurement. I want to say thanks to our supervisors. And I want to say to you, there are more to come because the government, the Ministry of Health, the President of the Republic of Liberia, they are all in line of encouraging and providing better health services to the people of Liberia. And Margibi is not an exception. So as we all work towards that, we look forward to making Margibi County Health System better and better again. Ladies and gentlemen, thank you. With not much ado, I want to see all the OICs that are here. So we want you to please line up. We have the keys.
So from British Africa, we stay here for the donation. We provide coverage to the donation of 23 motorbikes to health facilities across Margibi County by the Ministry of Health through the Margibi County Health Team.
The procurement officer to come and read a little about fleet management policy because you'll be